Dr. Lee Namhan Iris Lecture. Collected Papers on Iridology. A Human Black Box. Author Biography. Namhan Lee. Ph.D. in Science of Healing. Date of birth, April 18, 1955. Registered in Seoul National University's Hall of Honor. For research on iridology. World record holder in research on iridology. Certified winner of Nobel Prize in Physiology and Medicine for Iridology in Korea. Registered Master in Iridology in Korea. The first edition, first impression printed on June 1, 2019. The first edition, first impression published on June 1, 2019. Author, Namhan Lee. Publisher, Iris Research Center. All rights reserved by Iris Research Center, including the right to reproduce, copy and scan this book or any parts thereof in any form whatsoever. For information, address the publisher. Introduction. The basics of iridology is mostly based on Dr. Bernard Jensen's theory. Many iridologists have not attempted to determine diseases according to his theory, which has been akin to a common law. On the other hand, Russian iridologists have taken a novel approach from a bit different perspective. Their novel approach is far from ignoring the basic principle of iridology but rather complies with and applies it to lay a new foundation. The Communist Party of the Soviet Union made a range of attempts including health check programs to help its Olympic athletes perform better. One of those attempts was to analyze athletes' irides and thereby select those who had a natural bent for sports. Also, Russian iridologists engaged in a project of filming about 0.7 million soldiers' irides as part of their physical checkups. The iridologists classified the athletes' medical checkup data to find out similarities among their iris images before the project was abruptly discontinued. Still, an iridologist who had joined the project personally continued the study and formulated a method of diagnosing diseases with a visual inspection of irides. Afterwards, he handed down the method to his pupil Dr. Olga, who in turn continued to analyze patients' irides. The advanced iridology is largely based on Dr. Olga's teaching, and also deals with previous findings reported by overseas iridologists and data collected by Korean scholars. First of all, I make it clear what will be discussed in this book is not exhaustive. This book systematically compiles multiple iridologists' experiences and knowledge passed down until now, and will certainly be reinforced by further in-depth knowledge and information. Also, the content described in this book constitutes a new theory, which should be verified by readers. Most cases presented in this book are clinically tested and highly consistent. That said, for more accuracy, further studies in tandem with extensive efforts for verification and substantiation are necessary. Without doubt, and in principle, completely and exhaustively established findings should be published. Yet, given iridological analysis is ongoing and it would be better for more, not some, iridologists to join to verify and establish the content anew, I have decided to publish the non-exhaustive findings. I extend my deep gratitude to Mr. Lee Jongyun, the CEO of Iris Security Company Curatech, and his employees for helping me materially and morally with data collection, as well as to those who were willing to provide me with data. In particular, I extend my heartfelt gratitude to Mr. Kim Yusik, President Yoon Myongwon and Professor Cho Ori for sharing scholarly knowledge and data as well as helping me with writing and proofreading. Without their efforts, this book would be non-existent. Lastly, this is not a guidebook to follow for diagnoses but hopefully a reference material for surmising and investigating diseases. I earnestly wish this book proves conducive to the development of iridology. August 2009. Namhan Lee, an advocate of iridology. From Samchik. Natural Healing Iridology. Dr. Namhan Lee Biography. 1. Opticians with optometry optics. 2. Graduated from Kangwon University with a bachelor's degree. 3. Ph.D. in Natural Healing, Rhode University, USA. 4. Working as a United Nations Peace Ambassador. 5. Virginia Bible University, USA Vice Chancellor, Faculty of Natural Healing, Korea Campus. Awards. 1. Natural Healing Iridology World Archives Listing. 2. Nobel Prize in Physiology from the Nobel Foundation of Korea. 3. Western California School of Medicine Brilliant Award. 4. Listed in the Seoul National University Hall of Fame. 5. Won more than 30 awards, including the Medal of Culture and the President's Award. The process of change in health. Iris. Closed lesions. A lesion is a hole resulting from the science requires an in-depth examination. Hissence of iris fiber tissues. Lesions take, see section 4, chapter 1, pages 149-168. Different forms, which are largely categorized into closed elliptica or rhombus scions and open lesions, caused by parts of iris tissues sunken outward from the autonomic nerve line. Closed lesions include congenital genetic lesions and acquired lesions. Genetic lesions reveal web-shaped leaf-like signs in elliptica holes, which are not seen in acquired lesions. Deeper and darker lesions suggest the development of corresponding organs into the chronic or terminal stage. Tumors sometimes appear as closed lesions. Particularly, hyperpigmentation in closed lesions requires an in-depth examination. Hyperpigmentation drug addiction. Hyperpigmentation drug addiction. Hyperpigmentation refers to the presence of different types of tissues on iris tissues. Pigmentation is largely caused by three factors. First, it is inherited from parents. Second, it is caused by ingestion of large amounts of chemicals or instant foods with color additives. Third, pigmentation occurs when liver detoxification declines and toxins in blood accumulate in body organs. Even the same dosage of a medicine results in varying pigmentation depending on the capacity for detoxification. In those whose capacity for detoxification is high, pigmentation hardly occurs or disappears. In those whose capacity for detoxification is low, even a small dosage may lead to persistent pigmentation. Hyperpigmentation is seen in the parts of the weakest tissues, which conditions the growth of heterogeneous cells. Therefore, in-depth examinations and prevention are important. See section 4 chapter 2 pp. 169-176. Spokes. Spoke signs are named after bicycle wheelout. In case spokes reach an organ, which'll spokes. The spoke signs includes 4 pad in turn develops a symptom. It is crucial to turns. First, spokes head outward from the treat. The intestines first. See section 4 pupil. Second, spokes head outward from chapter 1 pages 164-165. The autonomic nerve rethals. Third, spokes head toward the pupil from the autonomic nerve rethals. Fourth, spokes head toward the autonomic nerve rethals from the pupil but fail to reach the autonomic nerve rethals. The second spoke pattern is most dangerous. Notably, spokes heading toward important organs, e.g. liver, spleen, kidney, bulbar and spine, indicate the sclerosis of those organs or parts. Spoke signs imply the routes through which toxins resulting from waste that is generated in digestive organs but not eliminated abnormally spill. Stress rings. One or more furrow-like rings appear in a circular pattern on the edges of irides. Stress rings show diverse colors ranging from white to dark black. Rings have depths. White nerve rings imply neuralgia and hypernoia. The darker the color is, the more damaged the nervous system is. Mostly, stress rings are seen on the outer parts of the irides, that is, between 4th and 7th zones, affecting muscles and other organs. Still, stress rings found within autonomic nerve rethals suggest neurogenic indigestion and atrophic cerebral cells that control the autonomic nerve system, lead to neurolepsis and muscular paralysis. People living in a complicated world have 1 or 2 stress rings. Still, 3 or more stress rings require stress reduction and physical and mental changes. Stress rings are more often found in Easterners than Westerners. Also, stress rings are more frequently found in the irides of a strong diathesis than a weak one. Allergic diathesis. Allergies are a strong pathologic process common. That is, autonomic nerves are involving the effects of the antigen and involved in the onset of allergic reactions. Tibety reactions on the body. An allergic diathesis is found in those. Diathesis is susceptible to allergic SYMP whose iris has a lymphatic rosary or TOMS resulting from antigen-antibody Os who have an addiction in the O. Reactions, vulnerable to the invasion or autonomic nerve system. In brown irides, absorption of antigen substances S, prone to form antibodies, and sensitive to nervous stimuli in mild antigen-antibody reactions. An allergic diathesis includes 1. Exudative diathesis. 2. Thymicolymphatic diathesis. 3. Angioneurotic diathesis, and 4. Hypersensitive diathesis. Easterners. Westerners. A black pigment is partially present from autonomic nerve rethals to the outer parts of irides. An allergic diathesis has dysautonomia in musculoskeletal weakness. The musculoskeletal system supports our tie-in and therefore requires a sound calci. Body, forms body types, sustains pHym sodium balance, seek or poises, underpins locomotion and protects all internal organs. Muscles are tissues segmented for motions and very important for storing nutrients, breaking down fats, and maintaining pH balance. Musculoskeletal weakness is reflected in the tiny holes distributed on the edge of the iris. The tiny holes are formed genetically or acquired. Calcium deficiency leads to multiple symptoms such as osteoporosis and degenerative arthritis, which make it difficult to maintain pH balance. In an acidic diathesis, musculoskeletal weakness leads to multiple problems in joints, which is attributable to poor calcium absorption. Poisoning. Foods we ingest are broken down in the stomach and small intestines, and thus nutrients are absorbed to sustain our life. Also, waste from the foods moves to the rectum and then the anus before being excreted from the body, with the water absorbed in large intestines. The food waste is supposed to be excreted in 24 hours. Still, when the bowel movement slows down due to constipation or other diseases, and the waste stays in the body for an extended period of time, the waste decays in the intestines and produces gases, while at the same time toxins produced in the decay process flow into the bloodstream, together with water, causing thick blood. As a result, the liver overworks itself for detoxification and then all body organs get exhausted and susceptible to diseases. If the foregoing condition persists, the person is afflicted with autointoxication, which refers to blood poisoning. Thus, the large intestine zone and the third zone or the blood zone in the iris turn dark, which constitutes the poisoning. Lymphatic rosary, lymphatic hyperemia. Lymphatic hyperemia is mostly found in Westerners with blue irides but hardly in Easterners. In lymphatic hyperemia, impaired circulation in the lymphatic system produces toxins, which cause the hyperemia, and the 6 zone corresponding to the blood and lymph system appears COV-aired with white clouds. In lymphatic hyperemia, colors vary with conditions. White, yellow and brown indicate early, sub-acute and chronic or terminal conditions, respectively. Lymphatic hyperemia is mostly found in Westerners because of the excessive intake of meats, which hinders toxins from being excreted through lymphocytes. Those whose irides show lymphatic hyperemia are susceptible to diseases in the lymphatic system as well as allergies. The irides of Easterners hardly show such a sign of lymphatic hyperemia as that found in the irides of Westerners. As for the lymphatic hyperemia found in the irides of Easterners, parts of the irides appear to bedding with black. Neutral fat, abnormal hepatic metabolism. Fats are absorbed in the digestive tract as substance molecules before entering the bloodstream via lymphatic vessels. The tiny fat substance molecules are stored in the fat tissue cells and blood. The stored fats are mostly subcutaneous fats, which smothers the thermolysis. When burnt, 1 gm of fat generates 9.3 kilocalories of energy. Despite the high caloric production and the indispensability for maintaining the body temperature, fats could cause multi-ple complex issues, including obesity, fatty liver and free radicals if excessively accumulating in the body. See the final chapter. Problems relevant to fat metabolism in the liver are manifested as yellow or brown rings on the sclera around the edge of the iris. Particularly, rings found in the upper part of the iris, brain zone, indicate such symptoms as the fatty liver. Those rings, found together with crescent rings, suggest the lack of blood circulation in the brain, which is highly likely to develop into an infarction or bleeding and cause a stroke. Blood circulation disorder. Blood circulation disorder is manifested as white or faint rings external to irides. Blackish rings are seen on the edges of the irides, or white rings appear inside the edges of the irides. These rings imply an abnormal blood circulation in the arms and legs, linked to a stroke and cold hands and feet. These rings are identical to the crescent rings found in the brain zone. Blood circulation disorder rings coupled with cholesterol rings are indicative of such diseases as arteriosclerosis. Blood circulation disorder and cholesterol rings are similar but distinct from each other. Cholesterol rings are formed in the refracting media whilst blood circulation. Disorder rings are formed when the cornea draws in the sclera, which in turn covers the part. Skin rings, dandruff edge. The dandruff edge starts in the 7th zone, or the skin zone in the iris, as dark rings, which spread inward heading for the pupil. Together with the lung and kidney, the skin excretes waste and breathes in fresh air. Once the function of the skin declines, the lung or kidney should undertake the function that are supposed to be done by the skin. When the skin fails to excrete waste and its condition worsens, the dandruff edge will further invade the iris, covering about half of the iris. Skin rings are usually found in the lung zone. Yet, when skin rings are found in the brain zone only, symptoms such as epilepsy pair, skin problems including acne and eczema, lead to the dandruff edge, which implies a deficient skin nutrition and should be overcome with the skin nutrient collagen. Sunbathing and bathing. Skin rings are easy to observe even without the light. When the light is shed on the edge, the skin ring present in the part where the light is shed is not easily visible. Blood vessel hyperemia. Blood vessel hyperemia appears on the edge of the iris, with a bluish ring formed on the sclera. Blood vessel hyperemia is supposed to appear on the sclera and the edge of the iris. Still, when the symptoms worsen, it climbs up the cornea and covers the iris, whose surface in turn looks bluish. See image 3. Blood vessel hyperemia appears when the venous system has problems and reflects the lack of oxygen or iron. Blood vessel hyperemia signs manifested in irides imply some wasting diseases, which warrants the need to identify the conditions of the digestive system, in particular. When blood vessel hyperemia covers the iris and the symptoms worsen, it is necessary to take note of the liver zone among the digestive organs. Blood vessel hyperemia is found in Easterners more often than in Westerners, which explains the much higher death rates from digestive system diseases among Easterners compared to Westerners. Crescent rings. Crescent rings refer to grayish frosted rings surrounding the cornea, usually found in the iris of those aged 50 and over. Still, they may be observed in young adults and children. Crescent rings result from the accumulating cholesterol and minerals due to the lack of lecithin, a nutritional ingredient facilitating the blood circulation in the brain, or from the decrease in blood flow to the brain due to structural cervical vertebral problems, which suppress the veins heading to the brain. Crescent rings imply the risks of anemia, hypomnesis, forgetfulness, chronic headaches, and even stroke with cerebral arteriosclerosis or vaso-occlusion. Thus, those with crescent rings should undergo a spine examination and in-depth brain diagnoses for prevention. Particularly, crescent rings combined with fat signs often develop into a stroke. Children with crescent rings are likely to suffer from a lack of concentration and hypomnesis, which has negative effects on learning. Cholesterol ring, sodium ring. A cholesterol ring looks like an extension of the iris. It is a white frosted ring found in the 6th zone corresponding to the vascular and lymphatic system. A cholesterol ring is also seen in the eyes of heavy drinkers. A sodium ring indicates a calcium-sodium chemical imbalance, result, ing from the lack of nutrients capable of breaking down the excessive inorganic salts and meats. Cholesterol rings in irides are indicative of hypertension, arteriosclerosis, arthritis and high risks of cardiac diseases. Occasional blood test results show low or normal levels of cholesterol despite the presence of cholesterol rings in the iris, which raises a doubt as to the authenticity of the iridology. Yet, when cholesterol is deposited and hardened on vascular walls, the cholesterol levels in the blood decrease and test results show normal or low cholesterol levels. Even in general hospitals, not a few patients are found to have cholesterol hardened on vascular walls during the surgery, despite test results falling within normal cholesterol levels. Declining iron retention. Iron is an integral mineral to generate hemoglobin, which delivers oxygen from the lung to cells, and is most abundant among the minerals in the blood. Iron is an indispensable ingredient of many enzymes, and increases the resistance to diseases. Iron is stored mostly in the liver, spleen and marrow in our body. However, when the liver function and its capacity to store iron decrease, iron levels drop or too much iron is released into the bloodstream. The former leads to anemia while the latter leads to a high hemoglobin count. A person with anemia has a pale complexion, whereas a person with a high hemoglobin (HGB) level has a reddish or blackish complexion. Declining liver function and resultant loss of iron storage capacity are manifested in irides, where, around the autonomic nerve wreath the tissues bulge, like hundreds of perilla seeds implanted. Butterfly-shaped lesions. Butterfly-shaped lesions refer to 2 to 3 or more lesions that are attached to a part in a butterfly shape. Butterfly pattern lesions are read as tumor signs or translated as recurrence signs. Butterfly-shaped lesions rare. Categorized into genetic and acquired lesions. Genetic. Butterfly pattern lesions are large in size, whereas acquired ones are smaller and form an aggregate. 1 or more acquired lesions are diamond shapes and their inner blackish grains are not clearly visible. The image below shows a butterfly-shaped lesion which is elliptica and large. Still, the image on the upper right side shows a diamond-shaped blackish small lesion. These lesions are indicative of a high susceptibility to chronic diseases and worth noting. Intestinal diverticulum. Intestinal diverticulum involves an infirm large intestine wall resulting in a pocky-T-shaped saccus cecus and is often found in the autonomic nerve wreath of the iris, often taking the form of a closed Luschauend in the autonomic nerve wreath. The pocket contains decayed substances whose decomposition generates toxins, which in turn flow into the bloodstream, causing several problems including auto-xica-ton. In some cases, food waste is not excreted but remains in the intestinal diverticulum for months or years before decaying and producing toxins, which in turn fill the intestine with gases. Intestinal diverticulum and its reflex acetion may affect other organs. For example, a diverticulum at 3 o'clock in the left iris causes reflex actions in the heart and thereby cardiac diseases. Also, liver, gall, bladder and breast diseases may ensue depending on the location of diverticulum. Section 4 Chapter 4 pages 182 to 188. Neurological communication difficulties, partial absence of autonomic nerve wreaths. Autonomic nerves are linked to all organs in our body, swiftly react to constant varying internal events, and maintain homeostasis. Yet, if a ganglion heading toward an organ has a problem or becomes dull, poor neurological communication and other problems ensue, which are reflected in irides. An autonomic nerve ring is supposed to bulge evenly on the surface as a ring. When neurological communication is not seamless, autonomic nerves are partially dented, indicating the given organ or tissue has a tenuous innervation. For example, the contraction of the anal sphincter that excretes the stool from the body is controlled by the sympathetic nervous system, the absence of which will fail the contraction of the sphincter. Undernutrition. A part of an autonomic nerve wreath floats on the iris surface, which is indicative of the undernourishment of the organ corresponding to the zone outside the autonomic nerve wreath. Also, only one part of the autonomic nerve wreath may bulge, which suggests the hypergasia of sympathetic nervous system linked to the corresponding organ. Physical impact. A part of the autonomic ring deviates from its original position and is formed on the pupil side, that is, at the position of the pupil sphincter, so it looks like there are 2 rows of autonomic rings. This phenomenon is formed by physical shocks such as traffic accidents. Acidic diathesis. Our body generates energy by burning the fuel, or food, which produces acids. Human body produces about 30 or more acids. When the acids fail to leave the body via excretory organs such as the lung and kidney, but accumulate in the body, our body attempts to excrete the accumulated acids by causing the catarrh in the nose, neck and bronchial tubes. Yet, if the condition repeats, the body becomes full of acids, with the iris assuming very light colors. Overacidity manifested in the iris is relevant to a diathesis susceptible to gout, rheumatism and arthritis. In that case, it is necessary to eat large portions of foods that alkalize the body, and thus to maintain the balance. In some cases the iris becomes bright overall, but in other cases the sign is limite to the part below the center of the iris. This implies the lack of circulation and excessive accumulation of acids in the lower body. An acidic diathesis with musculoskeletal weakness leads to multiple problems in the joint system. Susceptibility to chronic diseases, cancer. Unlike normal cells that can engage in regular and restrained proliferation and inhibition in accordance with the Needs of individuals. Undifferentiated cancer cells proliferate uncontrollably, ignoring the needs of tissues, invade and destroy adjacent normal tissues or organs, metastasize to any organs for further growth and even claim lives. Cancers are largely categorized into carcinoma, which is a malignant tumor occurring in epithelial cells, and sarcoma, which is a malignant tumor occurring in non-epithelial cells. Carcinoma includes squamous cell carcinoma, adenocarcinoma, base cell carcinoma and melanoma. Sarcoma includes fibroma, osteosarcoma, angiosarcoma, lymphoma, leukemia and myosarcoma. The incidence rate of cancers is 4 to 5 times higher in those whose overall iris tissues have countless fine black dots, making the iris look blackish. This sign is found in children of tender age and tends to develop into leukemia, thrombocytopenia and asthma. Hypochlorhydria, subacidity. The stomach zone darker than the outer zone of an autonomic nerve refill suggests hypochlorhydria. The lack of gastric acid in most hypochlorhydria patients causes the failure to break down proteins and to absorb other nutrients, leading to the failure to supply nutrients necessary for other organs and thus results in nutritional deficiency. Mostly, despite the presence of an absorption ring, hypochlorhydria patients do not feel pain and are diagnosed with a STOMACH cancer which proves terminal. The enteroptosis sign of a sagging autonomic nerve refill on the iris with hypochlorhydria indicates gastroptosis. Gastric hyperacidity. The stomach zone brighter than the outer part of the autonomic nerve refill zone indicates gastric hyperacidity. The front side of the stomach appears at the bottom of the pupil, whilst the rear of the STOMACH backside appears at the top of the pupil. In self-diagnoses, the pylorus is at 3 o'clock in the left iris, whilst the cardia is at 9 o'clock in the right iris. Balance. Gastric acidity is very important for breaking down proteins and for maintaining the sodium-calcium balance. Excessive gastric acid consumes much sodium, causing calcium to end the liquid phase and stiffen. Open lesions. In open lesions, furrows are formed by the dehiscence of iris fiber tissues. Unlike closed lesions with elliptica or rhombus holes, open lesions involve dented tissues. Since open lesions result mostly from acquired problems, they involve pain and other detectable symptoms. Unlike closed lesions, open lesions are characterized by a partial metabolism of the body and easy treatments. Open lesions include an elliptica type with an open outer part and a necrotized tissue with the opening extending straight to the outer part of the iris. The former type is usually found in blue eyes, whereas the latter has autonomic nerve refills opened as well, but still differs from the spokes. Since Westerners' irides hardly have melanin pigments, the grain of the iris fiber is visible and it is easy to observe open lesions, whereas the brown iris is dark with its grain being invisible, which requires a meticulous observation. Enteroptosis. When a transverse colon sags as shown in the image, the stomach above is pulled downward and other organs below are pressured, causing a few symptoms. Enteroptosis of the large intestine is known to be attributable to the lack of calcium in the body. Many women suffer from sycnuria and period pain due to enteroptosis, whilst some are affected by an ectopic pregnancy. To treat enteroptosis, the slant board exercise is necessary. Handstanding also helps treat the enteroptosis. In the iris of an enteroptosis patient, the autonomic nerve refill is stenosed toward the pupil at 5 to 7 o'clock. Enteroptosis exerts severe pressure on the organs below the transverse colon. Constricted autonomic nerve refill. A constricted autonomic nerve refill indicates a hyperstrain in the digestive system with a predisposition toward spastic constipation as well as acute indigestion. Mentally, the personality of this centripetal pattern is highly efficiency-oriented and discerning when it comes to social life and nutrition, and pursues quality rather than quantity. Those whose autonomic nerve reefs are constricted are advised to engage in extensive exercises and activities such as dancing, swimming and taekwondo. Thank you. Appreciate your effort. Contact +821084673564.